Tonsils are two collections of lymph nodes at the back of your throat. What they're supposed to do is to filter the food that we eat and to provide antibodies to fight against infections. But over time we find that these tonsils, although they are part of the immune system, removing them does not result in a reduction of the immune system. Many times these tonsils contain little holes in them called crypts or invaginations of the tonsils. Sometimes these crypts and invaginations can go very deep into the body of the tonsils and they can trap dirt in there. And sometimes this dirt will remain in the tonsils and cause recurrent infections. A person with bad tonsils can basically suffer from several kinds of problems. Number one is the tonsils could be too big and therefore it occupies space. When that happens, the patient will have trouble breathing, the patient will have trouble snoring and even eating. Then another class of problems that can affect the tonsils would be those where they get recurrent infections. So they get pains, severe pain and fever on a monthly basis. Many times this infection does not come from externally, it comes from within them. Many infections that we know of come from an infection from outside. You have to contact someone who can pass the infection to them. But someone with recurrent tonsillitis gets the infection from within them. So when that becomes a problem, then sometimes what we do is we have to remove the tonsils. A sore throat is a symptom itself, but sometimes a sore throat may be accompanied by other symptoms. So some of these symptoms we can divide them into things which are localized in the throat and things which are systemic, that means generalized. So things which are localized in the throat, for example, if you have a sore throat and then at the same time you also have a hoarseness, then we know that you not only have an infection of your throat, but also an infection of your voice box that will cause hoarseness. Then sometimes the sore throat could be lower down in the throat and then you might have problems swallowing. Or sometimes the sore throat may be higher up in your throat and then you may have problems breathing and speaking. Okay, tonsillitis is diagnosed primarily from the story. Sometimes a person will come with a story that says, I've got sore throat once every month, or I got fever once every month. Okay, when they have got that kind of sore throat, it's quite likely going to be a tonsillitis. The second thing we do is to look at the tonsils. So when we see the tonsil, if we see that the tonsils are obviously abnormal, then that's a clincher. It's very easy to make that kind of diagnosis. We know they have tonsillitis. But there are also occasions when the patient has tonsillitis, but when we look in, we don't see the tonsils being obviously infected. All we could see is maybe some redness of a certain part of the throat that suggests that the person might have tonsillitis. Now in that sort of situations, the diagnosis is slightly more difficult and slightly more nuanced, but we can still get a high suspicion that this person has tonsillitis just from the story itself. Then there's another group, and I see this very often in children. Children who get fevers like once every 2 months, and this fever will be very high, 39 to 40 degrees, and it will take about 1 week to clear. So they get these fevers on a very regular basis, but they have no sore throat. So research has shown that if you remove the tonsils in these children, the episodes of fever will go away. It depends on what kind of tonsillitis a person has. If the person has tonsillitis for the very first time, we call that acute tonsillitis. Most of the time they will respond to antibiotics or painkillers, and many patients surprisingly will improve even without any antibiotics. This is because many of these infections, 80 to 90% would be caused by a viral infection, and only about 10% would be a bacterial infection that would respond to antibiotics. Then there's another group of people who have recurrent tonsillitis. Recurrent tonsillitis means that they keep getting tonsillitis once every 1 month or once every 2 months. Those sort of infections are caused by bacteria, and the best treatment for them is not recurrent courses of antibiotics. The best treatment for them would actually be to remove the tonsils, so that they will no longer have to cope with these recurrent attacks in the future. Nowadays, with modern technology, we can do a tonsillectomy with very little bleeding and minimal pain. I'm not saying no pain, but just minimal pain. And this is a picture of the tonsils, of the right tonsil. And what we are doing now is to use this instrument called the coblator, or any kind of radiofrequency equipment that we can use to apply onto the tissue. Then once this piece of probe is applied onto the tissue, you can see that it cuts the tissue without causing any bleeding. And because there's no bleeding, we are able to see where we are cutting. Unlike in the past where the blood would fill the whole area and we'll lose sight of our direction. But now with this equipment, we can see precisely where we are cutting, and we need to cut in that plane that's between the tonsils and the pharyngeal muscles. If we don't remove enough tonsils, then we run the risk of leaving tonsils in the wound. But if we cut too much to the side, then we cut too much muscle out. So the trick is always to go right in the center, and by doing that, you can minimize the pain, minimize the scarring, and that's how we can get a good outcome. And most of these procedures will cause a little bit of pain, but the pain will not be as much as an attack of tonsillitis. And most of these patients will need some painkiller, and they should be able to go home the same day. And all it takes is just about 45 minutes to do this procedure. Okay, removing the tonsils, most people have this fear that removing the tonsils will result in a reduction of the immune system. But there have been countless research done by top institutions and published in peer-reviewed journals that removing the tonsils do not cause a reduction in the immune system. So once you remove the tonsils, the immune system is then free to do other immune system work in the rest of the body. Remove the tonsils is actually very safe. It used to be quite painful and bloody, but now because of modern surgical techniques, most of the time a patient feels so little pain that the pain from the surgery will be a lot less than the pain from the infection. And because of these modern techniques that we use, many patients don't even need to stay overnight in hospital. They can go home the very same day, they can start eating the very same day. And some people do get some pain on the third post-op day. Third to fifth post-op day, they might have a bit of pain, but even then this pain will be manageable and it will not be something that is catastrophic and out of the ordinary. So if a person has got tonsillitis pain and then he's get the surgery and experiences post-op pain, this post-op pain will be a lot less than the tonsillitis pain.